Thank you. So yes, I have been in education quite some time. I did my teacher training in '89 and I started my first teaching post in Norwich in 1990. So in that time, I've definitely seen some changes. I can honestly say nothing, all those years of experience has not prepared me for what we experienced in March 2020. And I look back now and I think, gosh, where have those last 2 and a bit years gone? Because they have gone in a flash. I have never, ever known a time like it. I say this to our students. I say this wherever I go. I have never known a time like it. Interestingly, we've had quite a few new starters into midwifery education, and boy, what an introduction they have had. They have had, and I have to keep saying to our new staff is that it's not, this is a different experience. And I think the things that we noticed the most as a team was we love our corridor conversations, as I will call them. We have our offices very close to each other. I was able to pop along into everybody every day and I would be able to chat to people and check they're okay. And you can have a discussion about something. Same with student groups. You go into the classroom and often you'd get a sense that something wasn't quite right. So like, okay, let's have a chat. Where are we? Let's see anything you want to talk about. And we could often iron out issues that never really got any further, because you're able to talk about it. And I think when we suddenly went from teaching face-to-face to overnight, everything online, it was such a massive change, huge culture shock. The working day was always extended, but it was extended to a double shift and occasionally into a whole 24-hour shifts, because it was a massive drive to actually do that, to put everything online. And people did struggle with that. And I think that's the one thing that, again, I've noticed with, since the pandemic, is the movement of staff in education. Normally it was quite a static workforce. You either moved to another institution because you was moving or you retired. But we've had people return to practice, people retired early, people have moved to different universities, and I've not come across that, I say, in all my 32 years. And that has been quite hard. So people that did start in lockdown didn't stay, majority is my experience. And I felt quite sad about that, because they never experienced education as it is, because to be with students, to actually have a discussion about something, and even though you might have taught something or you've been aware of something for decades, somebody will come up with something you think, oh, that's interesting, let's discuss that, let's work this out. If you're talking about research, what do you do in practice every day that we want to see if we can research this? And just to teach why some things are researchable and some things are not, building it as a group. To do that online is really difficult, because predominantly you're talking to dots. And that is it. And you would say, please put your cameras on just so I can see you, because that was another thing. As the groups, they didn't know each other. And because they either didn't see each other, you didn't have the group bonding. And likewise for the teaching staff, we didn't know them to look at. We only knew them online. And that was really quite different and difficult sometimes. So now we're coming back to back. It's, back to face. Again, we're finding that actually some students still really like the online, and some students like the face-to-face. So, many places, and others in particular, did do a Mentimeter just to sort of get the feel from the student group. How would they like things doing? Some things that we always kept face-to-face. We had to jump through hoops to do it, but we did it. And that's things like, the simulation, the moving and handling, those things that really have to be done face-to-face. But we're finding that because the digital literacy that we all thought we had, and we realised we perhaps didn't have it as well as we thought we did, we now have that digital literacy, because our learning was absolutely exponential. And so we are able to actually really give the best of both worlds. now, and I think students really benefit from that. I think students benefit from that, and we've been able to put on courses for midwives that normally they would struggle to actually be released from their workplace, or they were too far away because of the travel. We do it online, and I'm thinking of the PMA program, I'm thinking of the frenulotomy program, that has really allowed wider access that we just never thought possible. So that's a real plus, I do think. Obviously, we've had some challenges in these 2 years. We moved over to the SSHEA. I mean, many of us had actually started in 2019, but as the emergency standards kicked in March 2020, everybody moved over. Now, normally when a change like that happens in practice, we tend to go into practice to support and to explain, teach face-to-face, give lots of chats with the mandatory days. We have lots of booklets and things that we could hand out and talk it through. We weren't able to do that. We were a little bit, for some of us that implemented it a little bit early the year before, but not for everybody. And that was really hard to actually get midwives to understand the change. It was a standard and it had to be done. And also, of course, programs were being approved against the future midwife standards. That was another change. We had a national document that was approved for England and Northern Ireland. Wales have their own that was approved last year, and of course Scotland have their own, but for England and Northern Ireland we have the Midwifery Ongoing Record of Achievement. Many of us do it online. There are very few people now do it as hard copy, but there are still some. Again, that was another change, another new set of documentation, and again, so midwives were already stretched with what was happening, and they had students obviously that had to have the P group all the time, and they were having all these changes. It was just layering one layer after another, and so it was tough. Is all I would say. It was very, very tough. And obviously just things like online exams, and university didn't like us to do them face to face, but we feel professionally that they should be done face to face. Again, having all of that done, and obviously people's circumstances are changing all the time, and that's still happening. So when we'd normally have the peaks and troughs of assessments, and modules starting and modules ending, that is blurred. It is pretty much just a tabletop mountain at the moment, and we have nobody going down the other side. So I think that will level out, but that has been quite tough. And then another layer has come across with our the reports that we are coming out, Ockenden in 2020 and Ockenden coming out in 2022. And of course the recommendations from that, and ensuring that our students are supported, but obviously the practice area is changing, the proficiencies are still there, they still need to be achieved. Continuity care is one such element that I know has caused people quite some concern. It is a proficiency. The NMC are still clear this is a proficiency. There are just ways of how we can achieve this for places where it has been paused. For some places it is still an operation, and that works. Caseload holding is not new in midwifery. We've done this for years. So that is nothing new. So that should continue. It's just that the service reconfiguration has been different. And then we've had other reports, such as the Saving Babies' Lives Care Bundle, for all the right reasons, but that has increased the complexity in the clinical areas, which has meant that students are actually struggling to get their EU numbers, the number of births that are required because of the complexity, and that just cause students some anxiety. We look at placements. Labour ward is a bottleneck. It always has been, because every student midwife has to spend a significant amount of their programme there. And so again, that has just been another layer and another level. But as I say, I think from a lecturer point of view, we've managed these challenges. It's not been easy, but we've pulled together, and I think relationships with our practice partners are stronger than ever. When I started all those years ago, and in what we used to do was we was based in the hospitals as educationalists, and every morning one of us, because there was several of us, would all go to different placements on the ward. One would go to labour ward, one would go to the antenatal, postnatal wards, and actually sitting on the report. So you was able to then feed back to the students coming in what was happening in the hospital. Very integrated. As soon as obviously that separated out and we went into universities, that sort of changed the dynamic, and now we are guests, although many of people, many of the team, and I used to certainly for a long time work clinically, which helped. But this experience over the last 2+ years has really brought practice and us together, because we have had to work so closely implementing the changes, supporting the midwives, supporting the students, that I think that has been a real positive.